record to my computer. There we go. So for the recording, if you haven't figured it out yet, I'm not sure if I send the email out. It's under the announcements, and it's always going to be there week per week. Other housekeeping stuff. Oh, I have my fun factor today. US is the only developed country without universal health care. Why? People are paying $500 for insulin, actually $100. People are going bankrupt over health medical stuff, but yeah, that's my rant. So for the homework, make sure you show your work and watch for rounding. Pay attention to the rounding, because from now on, every time you take a test, most questions will tell you, question is blah, 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 blah. Round your answer to the nearest hundreds, to the nearest tenths, to the nearest whole number. And if you get this rounding wrong, especially with the heparin or any of the multiple questions, then the rest of the question is wrong. So pay attention to the rounding, especially now in the early stages of your drug calculation classes, and now that you're learning all this. If I'm having issues looking at your homework, I will email you specifically. I think I had a couple who you uploaded something and it didn't upload, or an empty file uploaded, and that's okay. Just re-upload it and that's it. Not a big deal. This is a low anxiety level class as opposed to your other ones. Actually, the skills is the more relaxed one, but it's so good. So let's do it. We're going to talk about drug abbreviations, labels, packaging, and routes, different routes on how we're going to administer these medications. Because I think next semester you're going to talk about pharmacy. You have pharmacy 1 or pharmacy 2. Maybe I'll get you for one of those classes, but and most of these things I'm going to talk about should be common knowledge by then, especially the routes. And let's do it. Abbreviating time of medications. I don't care about the source of these words, but memorize these abbreviations and their meaning. 3 of these things that you need to be familiar with is AC, meaning before meals, PC, after meals, and HS. Because as nurses, you guys will be giving some medications based on meal times. So if a physician writes, if your order says give 10 units of insulin AC or 5 units of insulin PC and HS, then that should give you an idea when to give it. Because if you're supposed to give a medicine PC and you gave it before meals, then that kind of messes up their, especially with the insulin, then it's not going to work out. You might end up dropping their blood sugar too much. So it's critical for medications. Quick questions about conversions. Okay.
Do we have to like show our work when we convert like grams to milligrams or something? Like, do we have to draw the arrow where we drag the decimal?
No, you don't have to do. No, you don't have to do that.
Okay.
So half of you, 75% of you probably do it in your head, but you don't have to do that. But when I get more technical with the calculations, those you do. All right, another one that you need to know that's going to be common knowledge a couple of months from now is this. If you're not familiar with this, get familiarized with this. This is how we speak the language of time in medicine. We go from 0, 100, 0, 200, 300, 400, all the way around to noon, 1200. And then it picks up 1300, 1400, 1500. So if I'm giving you a question, if a physician tells you, or an order says, administer this medication at 2100, you should know we are to give this medicine at 9 p.m. Okay, so learn this military time, and it might take you some time to get used to, especially for the non-military people, but you need this. It's not the first time you're going to see it. Routes. Another thing that you need to know are these routes that I'm going to be talking about. There's hundreds of thousands of medications out there, and they all have different routes. And here's a couple of them. Here's a few. Actually, here's most of them. One is PO. So when I say PO, that means by mouth. 81 milligrams of aspirin PO. 81 milligrams aspirin by mouth. I'm not going to take it through IV, through anything else, by mouth. It's the only way it's going to go. Another one that you need to be familiar with and is this, NPO. That means nothing by mouth. That means I cannot give my patient anything that will go in their mouth for some whatever reason. It could be they can't swallow, they can't, they're going to for surgery. And you know, if you had surgery before, you can't have anything in your stomach. Or they're going for some kind of test. There's a reason that this patient cannot have anything in their mouth. So make sure that's the NPO. And when you do get to the hospital setting, I'm not sure if you're going this semester, maybe next, you're going to see these signs all over and outside of patient's room. So if I'm little granny, sweet little granny saying, oh, hon, there's an NPO sign on my door. And I'm saying, Sonny, can I just have a little cup of water? Because it's been a long time since I had, my mouth is really dry. I just want to wet my lips. NPO sign on the door, that's a no. It's a non-negotiable. Okay? So pay attention to that when you get to your clinical settings. NPO. Other routes. So nothing by mouth. Other routes include this, PR, per rectal. Suppositories. It goes up the butt, insert the medicine in there with your finger, and that's it. But we have a slew of medicine that would go up the butt, up the rectal route. Hopefully, when we get to do this, I'm going to be there. I'm your clinical instructor, and you get to do this with me so I can walk you through it. And it's fun times, at least for you. Next, sublingual. There's also some medications that it goes in the mouth, but we don't swallow it. It goes under the tongue, sublingual. And what it does, your membranes under your tongue absorbs it, and that's how it gets into your system. You will get more details on these types of medications when you get to your pharmacy 1 and pharmacy 2. So when I get, maybe I'm one of those pharmacy teachers, and I'm going to tell you, hey, remember we talked about it last semester? And G-tube, GT, via G-tube. This is another one that you guys will be administering when you get to the hospital. Another route. Some patients have a tube coming out from their stomach, and this is how they eat. This is how they get medicines. This is how they get nutrition. For whatever reason that will be explained to you in Med-Surg 1, they had abdominal surgery, they had a stroke, they can't swallow. There's many, many reasons, but whatever the reason is, this is the only way they can have anything in their stomach. If you look at the tube here that's connected to a tube feeding pump, which is how we are providing nutrition to this patient. So in these cases, you will administer the medicine right here through this tube. And yes, this is something we do in the hospital. And another one is through the NG tube. I'm not sure if Yes, this is part, I'm not sure if this is part of your skills for this semester, but you're gonna learn how to put an NG tube. This is inserting a long tube up to somebody's patient's nose down to their stomach. Same reason. For some reason, the patient cannot swallow, something's blocking, they had a stroke, many reasons, but they cannot use their mouth. So we have to drop this tube up. It goes in their stomach. And this is how we're going to give food and medication to this patient. There's in these scenarios, there's certain ways to administer the medication, and I'm pretty sure it will be covered when you get to your skills part. And definitely we'll cover it when we go to the clinical setting. Next, standard international abbreviations and metric. We talked about this already. Metric is the most common that we use, and standard international is the international system of units. And we talked about this already for our review. Household abbreviations. Know it, learn it, especially from the teaspoon to the tablespoon and the ounces. The pints and the quarts, we don't really measure that much in the hospital, but definitely the tablespoon, teaspoon, and ounces, because that's something you're going to use for conversion. All right, now let's talk about some drug labels. There's a lot to unpack here. I'm going to start from the top. You've probably seen many drug labels, but nobody's really talked to you about it. You haven't really looked deeper into it, what it means. Starting from the top, drug strength. This is a 40 milligrams of whatever this meant in this case. This is a Lasix, furosemide, 40 milligrams. Going clockwise, this is a drug bottle. So drug quantity, there's 100 tablets in this bottle. To the right, lot number and expiration date from the manufacturer. And also down here, to the right, generic name, furosemide. If this has a brand name, it will be right under here somewhere. Lasix, furosemide, I don't know, there's many names for it. Manufacturer's name is right here at the bottom. The drug form, tablet form. It could be an IV form. It could be a rectal form. I don't think Lasix comes in rectal form, but. And also to the left, precautions. Dispense in a tight, light-resistant container. You're going to notice this when you get some medications from the Pyxis. When you get to the hospital, some medications will be in a dark bottle or in a dark bag. There's a reason for it, because it messes with the chemical structure of the medicine. And also storage there. If you always wondered why certain medications are stored in the refrigerator, stored in the pantry, stored in the Pyxis, it's because it's the recommendations from the manufacturer. Useful dosage up here. Usually it's in a form, in a packet that's attached to the medication. But in this case, for hospital purposes, this will be in the actual EMR, in the computer. Next, another one. Lorazepam, one of my favorite drugs. I've talked about it, I work in the critical care. Sometimes we get these alcoholic patients that are going through DTs, and this is my friend. This is my best friend for those going through DTs, going wild, because this will knock them out. Well, not just this, I kind of give them a lot of this in combination with other medications. But this is the main ingredient. Same, there's the NDC number. I don't think that's the number for the FDA, lorazepam, generic name. And if you go counterclockwise here, here's my ingredients list. And down here, for IV use, dilution is the required for this medication. Because for this specific medication, it's the consistency of an oil. So it's very thick. Imagine injecting that into somebody through the IV and its oil consistency. So the manufacturer recommends we dilute it, and we do. Next, ivermectin. This is a hot topic in the world of COVID right now. It is indicated for treatment and control of GI issues of certain animals. All the instructions are there, NDC number, precautions, all the warning labels are there. Next, let's talk about drug names. Trade name and generic names. Trade names, brand names, such as Tylenol, children's Tylenol. I can't think of much, Anacin, Afra, Alka-Seltzer. These are all brand names. When you get to the hospital settings, most of the time we use generic medications because they're cheaper. And actually, that's the number one reason. It's cheaper. And also when you get to the hospital, the generic name will be right next to the brand name in case we're using a specific brand name for this medication. Okay. This is an FYI. It takes about 20 something years for a brand name to be available for generic. It's when their patent is expired. Another medication types are unit dose packaging. This is what you will see in the hospital. Typically, when you go to CVS, Walmart, wherever pharmacy, you get a pill of aspirin, of Tylenol, or of something. It give you a bottle of 100 or a 50. But in the hospital, we have unit dose packaging, one pill at a time. Because can you imagine if my patient is supposed to get 50 milligrams of metoprolol, which is a beta blocker, blood pressure medicine, and they gave me a bottle of this medication, and I ended up giving them 2 pills instead of 1, then I just gave my patient 100 milligrams of metoprolol that may and will affect their hemodynamics. So when you get to the hospital setting, you're going to see unit dose packaging only, with a few exemptions every now and then. Because some medications, they cannot put it in a unit dose. Next, parental route. What is a parental route? Know this term, language, lingo. Parental route is anything that you have to inject. It could be IV, IM shot, and sub-Q shot. Speaking of IM shot, it kind of sucks that you guys are missing out. Over the past few semesters, we have been administering COVID vaccines over at UNLV and CSN campus, and we've administered like thousands of them. It was a pretty cool experience for the students, and we're not doing that now. Okay. So with these vials, they come in little, I don't know, little vials like about the size of half of my thumb. And when you're dealing with these medications, you have to pay very close attention to the concentration of the medicine, because this hydromorphone, which is Dilaudid, a pain medicine, a very powerful pain medicine. Dilaudid is, it says right here, 10 milligrams per ml. Standard dose of this Dilaudid is, I don't know, let's say 1, maybe even 2 milligrams of Dilaudid, which is a little on the high end. But if I think I pulled out one of these medications and I think, oh, I have a hydromorphone vial here, I'm going to pull it out, 1 ml, and I'm thinking I have 2 milligrams of hydromorphone, or 1, give it to my patient, but I just gave my patient 10 milligrams instead of 1. Okay. Overdose. So you're going to have some issues there. There's going to be some safety checks throughout the hospital. So don't feel like, oh shit, it's on me. This is I just killed somebody. No, there's many, many, many checks that goes on in the hospital setting. So, but the thing is, you are the final check. We are the final checkers. So, because there might be 5, 10, 15 different checks that this medicine has to go through, from pharmacy through to the unit pharmacy, to the nurse, to the tech, delivering it, and you are the final checker. You know about that Swiss cheese effect, that everything lines up and stuff happens. It's that. Another parental route that you will see, this is a digoxin IV. If you notice my bottle here, it comes in a glass bottle, which is there's a handful of medicines that we use frequently in the hospital that comes in a glass bottle. So how to open it is there's no caps, there's no seal, there's no nothing. It's this little, see that little red line? You will break that off and aspirate the medicine from there. Kind of dangerous because I've known a few nurses who cut their fingers because of this glass bottle. There's also tools that we use to open it easier. But in this case, one thing to remember is I am not going to use a blunt syringe or a regular needle to aspirate the medicine that's in this glass bottle. Because when I open this glass vial, very tiny, minute particles of the glass may have fallen in the medicine, in the vial. So what I'm going to use in this case is a needle called filter needle. I'm going to use this, put it in my vial here. And what this filter needle does is right here in this pink area, there's a filter that filters out anything, any minute particle that goes in the syringe. So no particle, you can be rest assured that your patient will not be getting glass particles from this medication when you give it to them IV. Next, plastic bags or vials. These are sterile medications for IV use. We're going to get to the IV piggyback, IV drug infusion, maybe the next several weeks. And they're one-time use, ready to use, especially in my critical care setting world. My dopamine, dobutamine, cardiac medicine, fentanyl, pain medicine, sedation, everything. Most of them will be either in this type of bag or in the glass bottle, like the propofol. That's a glass bottle. Other ones are ready to pre-filled syringes. When you get to the hospital, these are out there in the hospital. They're just laying around. They're not supposed to, but they are laying around. A lot of students have them in their pocket. You're gonna go home with it. You're probably gonna go in the parking lot and spray each other with it, which is okay. But because it's there, it's readily available, and they come in buckets. You just grab a handful and it's good. Why would these drugs be in glass containers? It's from the manufacturer. It's something with I think it affects the chemical structure of the medicine itself. I can't tell you what the ingredients are. The drug could be. Next type of medications will be your pre-filled cartridges. These things are ready to go. In this case, this is a medicine called Lovenox, which is a very good blood thinner. And when you open this thing up, it's ready to go. Medicine, one-time use, one per patient. The needle is attached to it. It's boom, ready to go. Inject it to your patient and throw it away. Okay. Yeah, this is one of the, this may be one of the first, when you go to the hospital, this may be one of the first sub-Q shot that you administer. When you get it, you're gonna look at it funny. You're gonna say, I've never seen anything like this before, but I'm gonna walk you through it. I'm gonna give you a tour on how this thing works. Next, topicals. Applies to mucous membranes. Doesn't matter where the mucous membranes are, under my tongue, up my butt, on my skin, wherever I have mucous membranes. And they can also achieve systemic effects. Examples are transdermal patches, like your nicotine patches, lozenges, suppositories, and they come in plastic disposable. There's your suppositories and nicotine patches. Next type of medication packaging is a multi-dose packaging. Here's one of them. This is an antibiotic called Zosyn. It's you have to reconstitute this medication yourself, meaning you have to have a saline bag or whatever the manufacturer recommends to mix this medication with. You have to do it. Okay, you're going to do it with this medication and other medications, reconstitute, and then give it to the patient. It's something you're going to learn when you get to your skills lab. Okay. Other multi-dose packaging is this, a nitro tab, sublingual. If you have a family member, a friend that has a history of MI and they get chest pains, they probably, I hope, they have this in their purse, in their pocket, in a pen, available at all times. Because if they're having chest pain, this is their go-to. This should be their go-to, nitro under the tongue. If they don't have it readily available, get on to them. You can tell them, hey, I just learned in nursing school, you're supposed to have this thing available at any time. Because if you're out at Walmart and you get chest pain and your medicine's in the pantry cabinet at home, 911 will be called. Other multi-dose packaging will be your eye drops and your inhalers. These are what you're going to see in the hospital and also in the home. Inhalers, some of you, I don't know if some of you are asthmatics, you know, with this little inhaler thing, you can use it 30 days, 60 days, and depending on how much your airways are acting up on you. So there's many ways to measure these medicines, to prepare them. There's so many, a pill, half a pill, ml, in ounces. Do I need a big syringe, little syringe? It's up to you guys to figure this out as a nurse. It's not going to come with instruction. Use a 3 ml syringe and a 22 gauge needle to mix this medication. No, it's your job. It's your call. You can use whatever you want. Okay. Luckily for us, we have these. We don't have to guesstimate how much lactulose we're giving my patient. It's right here. We have these medicine cups, and it will tell you exactly 30 mLs, 45 mLs, 60 mLs. It's precise. And also these medications in syringes. Whatever syringe you use, it's there. It's different sizes from 10 to 5, 3, 2, 1. You have your insulin syringes. You have your heparin syringes. They're all specifically designed for medications. One thing to remember is that the only thing that's different out of all these medications is your insulin syringe, because all the other syringes are in mLs, 1 ml, 5 ml, 3 mLs. Your insulin syringe is going to be in units, because when you're administering insulin, it is it's going to be in units, 10 units, 15 units, not ml. rule of thumb with insulin is if you have to administer more than 1 ml of insulin to a patient, you need to step back and start over. You're about to give my patient you're about to overdose my patient in insulin, because a typical dose for insulin is 2, 3 units, 5, 10 units. That's high. Long-acting insulins are 20, 30 units, maybe 50 on the high end. So, and this is not even close to being 1 ml. Okay, and that's one of the biggest side effects, biggest precautions when administering insulin is the overdose, which can cause not international units, just units, 10 units. One of the biggest precautions for insulin is hypoglycemia, because if your blood sugar is high, I can fix that. I can easily fix that. But if your blood sugar is low, I can fix that. I can fix it. But the less sugar you have in your brain, time is ticking. Time is ticking. Then you're going to have some neurological issues. Okay. And also, you're going to have some pills that you need to crush. You need to cut. And these, like I said earlier, everything is precise. There's no guessing. So we have these tools in the hospitals that you will be given. It's available to you. Like this thing on the left, I think the Valley Health System uses this. This is the pill crusher. Crush, crush, crush. You drop your pill in there and crush, crush, crush. It becomes a fine powder. So now I can give this medicine, this fine powder, to my patient who's maybe having a hard time swallowing. And I have to crush the pills and put it in some applesauce or pudding. Or maybe I need to administer this medication through the PEG tube or the NG tube. So I need to crush these medicines so I can dissolve them and it goes in the tube. And also these pill splitters, pill cutters on the right. Notice they cut the pill and it's exactly in half. There's no guessing of, I think it's almost half, so that's good enough. Or maybe one is 3/4. You can't just, some of them you can use your hand or you're not going to get the right amount of pill. So use these equipments, and it's easily available. It's in the med room. Just grab one. There's many of them. That's it. That's all I got. See, this is an easy section. This is an easy one. That's it. There's a homework, Henke's arithmetic, 78, 73. That's it. Questions? No questions? Test next week. Have a good day. Good luck. I know there's a question. I know there's a question.
Regarding the textbook, it had some do not use anymore. Do we need to know those do not use abbreviations? And also I had one question with military time. Midnight, is that 0-100 hours or 2400 hours?
Cool.
Or
I've used
okay.
both. I've used both.
Okay.
Do not use abbreviations. Did I add that? Because so your question is, do you need to know these do not use abbreviations?
Yes, there was some in the textbook. I didn't know if that was something that you wanted us to be familiar with for the exam or not.
You can be familiar with it. I don't think I threw that in the pot of the exam.
Okay, thank you.
Other question?
Basically, if it's in the book, but it's not PowerPoint, then we don't have to worry about it, right?
Right. I'm only going to test you on
Okay.
whatever I tell you, because that's, yeah.
Okay, so for the abbreviations, the ones that you gave us here are the only ones that we need to know.
Yes. Yes.
Hold you to it, Professor.
Okay, yeah, if there's something on there that you find out, hey, you said this was not gonna be on there and it's there, hey, call me out. Because sometimes I'm not thinking, I'm thinking, maybe we did cover that. Maybe I don't remember, but and also when you submit homeworks and maybe I misgrade something, just tell me. This is a chill class. Can't
Wait, I
speak
have
for
one more
next week.
question. Didn't we already do proficiency test 1, or was that like a different proficiency test?
Is it proficiency test 1?
Profi-
I think you're correct. See, there we go. That's what I'm talking about. Maybe I meant 2 or 3. I don't know. I have to look, but whatever's on the schedule.
Okay, I think it says 3. I just didn't
3.
know if like
Okay.
1 was a different one because it says 2 of them. Okay, just making sure.
A perfect example.
And
Thank you.
like, what are the proficiency test 3 exercises? Like that one's not on the module on Canvas.
It's not.
It
I'll-
should be. It's like I already did it. It says like the military time and like some of the oral routes.
Okay.
It's on chapter 3 on page 78 and 81. It's actually, it does say proficiency test 1 and proficiency test 3, but just for chapter 3. Just 2 of
Oh,
them.
all right. Maybe I wasn't half asleep when I was doing that one. But let's see. I made a little cheat sheet on what you need to know for the test. You guys want to go over it? No? Did I lose you? Oh, my internet just died.
Yes, yes.
Oh, this is the worst time. All right, let's see. What do you need to know? I think I'm your very first test in nursing school, right? Am I?
No, we have nutrition exam right after this class.
Oh, dang it. Who is that? Dawn? She beat me to it. All right. First order of business. Converting micrograms to milligrams to grams to milligrams, standard, moving the decimal around. Should be one of the easier tests because it's mainly a review. Know what are metric system measurements, grams, milligrams, grains, whatever they are. Convert my kilograms to pounds or pounds to kilograms. And leading, oh, what do I have this here? Leading zeros. What do I mean by leading zeros? That means something. Leading zero. Why is it important that I have leading zeros on all my numbers? From if I have 0.5 milligrams of medication, why do I have to put it down as 0.5 milligram of Ativan? Another one is which room for exam next week? The same room we were in. 244, I'm guessing. I'll give you more. I'll send out though, because I forgot the room number. I just know how to get there. Not computer lab. So good one. So bring your computer. You're going to be testing using your computer. If you don't have a good laptop computer, go to the campus and borrow one. You can even use mine. You can use the big computer on the screen. If you don't have if you don't have a computer, a laptop. Let's see what else. Converting ounces to mLs. If my patient drank 8 ounces of orange juice, 4 ounces of coffee, and 12 ounces of gin, how much is my intake? How much is my fluid intake? Remember, you can only measure my intake through mLs. Is it 7? I'm thinking, damn, that was pretty good. I was just making up numbers along the way. Add the drinks. And you need to know if I have a vial of medication, 2 milligrams that I need to give my patient, and I only use 1 milligram out of this vial, what do I do with this other medication? Do I throw it away? Do I give it to the FDA? How do I dispose of this medication? I don't think I covered that, but you have to dispose it. You need to have somebody dispose it with you properly. We didn't cover that. There we go. I just covered it. Don't throw it away. Dispose of it with another nurse. That's a bonus question then. Military time. Know your military time. Know your conversion from teaspoon to ml. Oh, I do have one question there that I'm gonna push you a little bit, but not really, about I have a medication that's weight-based. That means this vancomycin drug is I need to administer, let's say, 20 milligrams per kilogram on this 200-pound patient. So how many mLs do I need to give my patient? Something like that. Or 15 mLs per kilograms, and my patient is 200 pounds. So how many mLs should I give my 200-pound patient of this lactulose or something? Whatever medication is. Just to let you guys know, here's a trick that we use. I'm going to give you that we use. There's a lot of distractors on these tests. And sometimes you guys get sucked into the distractors, which is good. This is what we want you to do. Focus on the distractors. But now you know there's distractors there. So I could be giving, my patient is a 24-year-old patient from Mississippi who came to Las Vegas having a good time, bought some Coke, smoked some weed, overdosed on alcohol, and now he's in the hospital going buck wild. So now I need to give my patient 2 milligrams of Ativan. How many mLs is that? See, the storyline had nothing to do with my question on how many mLs of Ativan should I give my patient. Okay, but so now some of you are thinking, oh, overdose on cocaine, weed, alcohol. Oh, with the Ativan, I don't know if it's gonna mix with the Ativan. Maybe I need Haldol too with that. Let's throw in Sabennet. No. Now you're missing the point. Now you're adding stuff to my storyline, which has nothing to do with the question. So pay attention to that. It's not just my thing. Everybody does it. What else? Math is for calculating drugs. Oh, what are the 3 ways of calculating drugs? It's in one of the slides, 3 ways, racial proportion, dimensional analysis, needs over wants, something like that. I think that's it. Did I say convert the temperature? If I didn't, know how to convert the temperature. That's it. And if you're studying for this test and you have any questions, feel free to text me. I answer if I'm available. I will answer to you. And I will guide you to the right direction. Any other questions? This is almost like a gimme test. So don't stress about it. Calculators are allowed. Oh, thank God. No calculators are allowed. I will give you, good question. What is that, Tiffany? I will give you calculators for this test. We have hundreds of these cheapo calculators on campus, and this is what you will be using to for this drug calculation. Get used to these calculators, because every time you take a math test on camp or a drug calculation test on campus, this is the calculator you will be using. In fact, I need to request for them. Any other questions? What time is it? The time? What time is the test? Same time, 10 o'clock. You have, I think, 15 minutes. I gave you like a minute and a half, maybe a minute, 15 seconds per question, but don't stress. It's all good. Well, yes, I am. Takes about an hour to process, but how many questions? 25, 20, 25? I don't remember, but I'll let you know. I think it's 25. Forgot. Right around there. Is it 30 questions? I forgot how many. Okay, it's 30 questions. There's no surprises. There's no gotcha questions. It's fairly straightforward. I'm not here to gotcha you. The gotchas are coming up next semester. Remember, I'm still warming you up. I'm still setting you up. Anything else?
I have a question real quick.
Okay.
So each chapter has proficiency tests in it. So it just says proficiency test 1 and 3 for 78 and 83. Do you want us to do proficiency test for exercises in page 78 and then proficiency test for page 83? Or do you want us to do 1 and 3 for 78 and 83?
I'll send an email. I can't see it. So I'll send an email out because I can't look at it. I can't see it right on.
Okay, because it sounds like it's just proficiency test 1 for page 78 and then proficiency test 3 for page 83. I just wanted to make sure.
Okay, I'll let you know. I'll let everybody know.
I
Okay,
think
thank
the
you.
proficiency test for that one is page 81, 82, and 83. I think the whole proficiency test includes those topics.
That sounds like a lot.
It says continued, it says proficiency 3 test continue. So we got labels and packaging. And it's just continuation of that over 3 pages. It's not that much.
There we go. But I'll send out a clarification.
Okay.
Anything else?
And then can we just get the answers to this real quick?
It's A, B, B, C.
Oh, is it? It's not multiple choice though, is it?
None of the above. There's a lot of none of the above. No. This is the gimme test. Relax. Worry about the other test.
Yeah, they have like the nutrition test and like our cough.
Yeah, focus on nutrition test. There's not much to focus here, but what is ounces to mLs? All right, guys, if there's no other questions, let me know. I'm checking out. Text me if you have any questions. You can try emailing me, but you know, I can't answer as much because I don't see it. Still need to change my setting. All right, if there's any questions. Also, Jean, don't forget Jean. Jean is like the best pharmacy student in the history of NSC. She doesn't know it, but she is. Use her. We're paying her $50 an hour for this. Might as well use it. Make sure you give me my cut, Jean. 20%. All right. See you guys later. And boom.